Well, I'll capitalize on some of the things these gentlemen said and talk about strategic discipline. Staying the course with a massive transformation, migration activity. It's easy for us to kind of get taken off course. So to talk about what Sean says, defense health and veterans health had really been a mainstay for electronic health records and really getting out there and doing it in the 80s and the 90s. And really I saw a lot of transfer of information and knowledge to industry. And then industry really took that, I think, in the early 2000s. And we've seen that kind of with ONC's help, really kind of leverage those lessons learned. Looking back over that entire history, I think it is now time that we kind of take advantage of all the lessons that industry has learned over the last 10 years, 15 years in implementation, broader implementation of electronic health records across the entire nation. So we're looking to take advantage and leverage the new technologies that are available. And a couple of examples of that are you know, the security aspect and providing cybersecurity in that sensitive healthcare information environment. The DHA has stood up, using lessons learned, DHA has stood up a cyber operations center and able to take advantage of the tool sets that are available now to do monitoring and security incident and event management across the enterprise. So our focus now is looking at, rather than standing up silos of IT across a large global enterprise, we're trying to bring that in with the technical transformation and what I previously referred to as the medical community of interest network and the desktop to data center approach.
And I would imagine with this tectonic shift in technology that there's been considerable analysis done on how to secure this environment and this new sort of way of operating. How long have you all been planning for this new transition that you're in the process of making? How long has that been in sort of the planning cycle? I just want the audience to appreciate sort of the thinking that's going into this.
So when the DHA was stood up, we looked at the entire technical portfolio across the ecosystem, and it was determined that we needed to do something. As Ed mentioned yesterday at our industry day, one of our big problems is what I call IT urban sprawl. And that is IT in silos that's not well connected. It's not, we don't leverage the full value of the information and data that we have stored across all of our systems. We have interconnects and we do share data, but it's time to kind of leverage that. I call it leapfrogging. We would like to leapfrog into the next generation of healthcare.
You see that quite a bit, you know, telecom industry, et cetera, where things get leapfrogged.
Absolutely.
How long has DHA been in existence, just for the listening audiences?
DHA was stood up, initial operating capability in October of 2013.
Okay, so not that long ago.
Not that long. Planning started on the technical migration, some of the activities that had to take place in order to stand DHA up. Interestingly enough, for those that aren't aware, the DHA was created out of moving personnel and resources from each of the services. So it was originally called a shared service environment. So the Army, Navy, Air Force all contributed out of their medical, the Surgeon General's staff and the Defense Health Program, portions of staff. Talk about cultures, bringing all of those cultures together to create the DHA in 2013. But the health information technology piece went all in, where others were you know, had longer term plans. On 1 October 2013, health information technology is all in, because we understand that we have to build this foundation in order to build up the rest of the healthcare system. It is an essential support function, a critical support function for military health.
A lot of